Long COVID can be confusing, painful, and debilitating, but for many women of color, it can also be isolating. That is why hundreds have turned to this long hauler online support group on Facebook to share their frustrations with the illness and with our healthcare system. Equity policy advisor and long COVID advocate Cynthia Adinig joins me now. She and her son have been fighting long COVID since March of 2020. She's a member of this support group. Cynthia, thanks for joining me. You have been to the hospital for long COVID more than 20 times over the past 2 years. You are still dealing with nausea, dizziness, intermittent paralysis, and a high heart rate. So first of all, tell us how you're feeling today, and also why has this been such a lonely experience?
I'm actually doing really well today. Surprisingly, I went outside yesterday. I react to air, so I didn't know how to handle going outside to the DMV, but it was okay. It was fine. I'm on a good medicine regimen finally that can help me to do, go do normal things ish every couple of months or so.
Well, you joined. Go ahead.
Oh, I was going to say, the group is partially why I'm able to do so many of these things, the things that I learned from others who had the same symptoms as me, knowing that I need to go to see an allergist, knowing what medications are helpful or not helpful, and then also knowing that there's going to be struggles there when it comes to racism, when it comes to getting my care and knowing what to expect and how to handle it.
You know, we were talking to medical reporter Erica Edwards yesterday about COVID bullying for people who are mourning the loss of a family member to COVID. I imagine that some of the isolation part of this is from folks who don't believe in your symptoms, who are gaslighting you. Can you speak to that isolation? And what are you learning from your fellow members in this community about how they're coping and how they're progressing?
Yeah, the isolation is really, really difficult, especially for those of us who have issues with either mobility or like myself, who I don't tolerate outside air. In fact, even in my home, I have to have ultra-filtered air. And so it makes even in-home visits difficult and outside visits difficult. And that makes it hard. And what also makes it hard is that you see me now and I look fine and I feel fine. But, 2 months ago, I was in the ER from anaphylaxis. So it really messes with people who don't have this experience that we are more well than what we are. And so it can make them feel like we're making excuses for why we can't go and do things and why we can't be involved in the family traditions, Thanksgiving. I haven't had a Thanksgiving family in 2 years, so it's really...
Well, I want to take a listen to something that you said in your testimony about long COVID to Congress earlier this month, and then we'll talk on the backside.
It is clear through unbiased studies and historical records that race and gender play a major part in hurdles in American healthcare. A select few may even say I should simply be happy with the current level of long COVID healthcare in America, that my privilege of standing here before you should be enough. But to quote Martin Luther King Jr., I criticize America because I love her.
What would you say to people who are suffering from long COVID as you are? How can they get support? What should they know?
Wow. A support group is so integral to this because you lose a lot of friends and you lose a lot of family. And it's hard to even explain some days what you're feeling, how you're feeling. So having others who experience what you experience is vitally important to your mental health. So it's really, really important to find there's a lot of support groups on Facebook. There's another one on Slack and other spaces now, like Kindred. There's other support groups out there now.
So important not to feel alone. Equity policy advisor and long COVID advocate, Cynthia Adinig, thank you so much for your time today.
Thanks for having me.